My project addresses inequalities in who becomes a child looked after by the state in England. From the outset, I hoped to influence policy. I started by describing the problem, examining trends and inequalities over the past decade. Then I used mixed methods to assess how changing inputs at local level explain changing inequalities. In the quantitative work, I've used linked routine data. I used the natural experiment or unnatural experiment born of the differential impact of austerity policies across England to tease out the contribution of different drivers. In parallel, I've conducted interviews with senior policymakers in children's services. I want to understand how they make sense of changes over the past decade and how this has shaped decision-making. These different strands of the project are interwoven. First, in describing inequalities, I established that they have been widening since around 2008 relative to previous trends. A first paper based on this work was published in BMJ Open. In assessing drivers of these rising inequalities, I found that cuts to prevention services for adolescents were linked to more older children entering care. This wasn't the case, however, for services catering to families with younger children. The second paper was published in Children and Youth Services Review last year. Using new official local area level poverty data, I found that child poverty was a major driver of rising care entry. This third paper will be published in the Lancet Public Health imminently. I've conducted qualitative interviews with 15 policymakers across 6 local authorities. Analysis of the qualitative data is very much ongoing. In the meantime, an abstract based on the work has been accepted for an oral presentation at this year's SSM conference. Emerging insights from the qualitative research led me to new research questions. My participants were persuaded that Ofsted inspection affected care entry. Yes, there's the decisions we make, policies we make, investments we make. There's also the Ofsted regime and where you are on your cycle of inspection. In assessing this quantitatively, I found that inspections were in fact associated with a spike in interventions. The worse the judgment, the steeper the rise. But there was also an inequalities dimension to this phenomenon. In the most deprived areas, as in the least deprived areas, worse judgments were reliably met with the most drastic investigation-oriented interventions, but not with the more family support-oriented interventions, unlike in the least deprived areas. This paper is currently in press with the Journal of Social Policy. Working with and sharing Ofsted data gave me the opportunity to collaborate with academics beyond my research group on an adjacent question. Is there an inverse care law in children's services quality like in health services? The resulting paper, first authored by Dr. Callum Webb, was published this year in Social Policy and Society. It shows that, contrary to claims by the National Audit Office and Ofsted, quality is a function of deprivation and funding. Higher deprivation and lower preventative spend are associated with worse judgments. I've made efforts to engage with policy throughout my project. This is a map of those efforts. In cool colors are forms of local engagement, in warm colors are forms of engagement with national stakeholders. A policy placement in Liverpool City Council led to an evidence briefing building the case for a specialist adolescent service. It also informed my own age-stratified analytic approach to some of my quantitative work. The relationships I formed aided recruitment to the qualitative research, which itself led to that additional paper on the inequalities impact of the inspectorate. I've involved a senior practice partner in that research, benefiting from their expertise, and we anticipate dissemination networks. Ultimately, academic research networks have been key to national engagement. Opportunities afforded me by supervisors, co-authors, key figures in the field have culminated in several national policy outputs. I'll present just a few of these. My work was presented in a submission to the DWP Select Committee on Child Poverty, leading to recommendations about a cross-government strategy on child poverty. On request, my work was included in the Case for Change as part of the ongoing government-commissioned independent review of children's social care. This initial document set out the review's early findings and what needed to change. The final report is due any day now, and certainly by the time you'll be seeing this presentation. Our evidence briefing on the impact of the likely rise in child poverty as a result of the universal credit cut was included in a Guardian article. The preprint of this research has also sparked articles in Community Care and Children and Young People Now, forums widely accessed by social care practitioners. My work features in a chapter on looked after children in the N8 Research Partnership Northern Health Science Alliance Child of the North report, and in an evidence review of the relationship between child poverty and child abuse and neglect. The authors were generous in including me in their acknowledgements. Finally, my work is being included in a briefing note produced by the National Childhood Bureau. They plan to hold briefing sessions with the Treasury and Department for Education and have informed the Independent Review of Children's Social Care. I'm still very much on this journey, but I'd like to briefly pause to look back. 4 years ago, I was a key worker in supported accommodation. I loved my job, but I wanted to understand root causes of the challenges our young people had experienced. The School for Public Health Research and my incredibly patient, incredibly generous supervisor have made this possible for me. They saw my experiences on the front lines as an asset, and they've given me every opportunity to learn and gain valuable skills. They've supported me through a global pandemic. I've certainly gained in confidence, and I'm not sure what's next, but I feel that many paths are open to me. For that, I'm very, very grateful. So thank you.
Hi, I'm Natalie Bennett, a research assistant at Newcastle University. I recently passed my SPHR-funded PhD at the University of Sheffield, entitled A Theory-Driven Approach to Understanding the Effect of Ethnic Density on Mental Ill Health in England. The ethnic density effect refers to the finding that when people from minority ethnic backgrounds live in areas with more people from the same ethnic background, they tend to have better health. And this is especially the case in mental health. This is important as there are ethnic inequalities in mental health in England. Understanding why ethnic density is protective of mental health may help us to address these inequalities. Researching the ethnic density effect presented several opportunities and challenges. Multi-level data were needed with individuals nested within areas. Several pathways operating simultaneously between ethnic density and mental health required investigation, including complex constructs like social cohesion. I therefore needed to apply advanced methods to the analysis of the ethnic density effect. I was fortunate to be able to travel to Bamberg in Germany in the second year of my PhD to undertake a winter method school course run by the European Consortium of Political Research on structural equation modelling. I was then able to follow up with an online course in multi-level structural equation modelling. This gave me the skills I needed to perform the complex analysis required to investigate the ethnic density effect. During the course, I learned several advanced methods, as well as the use of new software and established international connections. After the course, I was invited to contribute as a teaching assistant, the second time it was run, and I'm currently collaborating with the course lead on a paper using the method. Attending the ECPR Method School had a big impact on my PhD research, as well as on my career development. In addition, during my PhD, I was able to collaborate with ECR colleagues both within and across institutions, collaborating to a ResNet-funded project on social isolation, and organising an interdisciplinary ECR conference at Sheffield. I was able to attend and present at several leading public health and social science conferences throughout my PhD, thanks to the support of SPHR. The PhD and the training I was able to access gave me unique quantitative skills that helped me to demonstrate my willingness to learn new methods. The PhD allowed me to begin developing an academic network and enabled me to begin establishing my career in public health research. These skills and experiences helped me to secure a postdoctoral role at Newcastle University, where I continue to apply my quantitative skills to investigate inequalities in health. Thank you for listening. You can find out more about my PhD research using the QR code on the screen now.
My PhD thesis focused on the impact of economic shocks on health and health inequalities. For sure, some of you have experienced or have heard that during the Great Recession in 2008 and during this pandemic, any family member have lost their job or have seen reduced their household income. These economic shocks have meant an increase in unemployment rates and a financial insecurity for many households, which may affect the individual health. So why my PhD project is relevant? First of all, for a health policy perspective, we know that public resources are limited and government resources the crisis during economic crisis. Therefore, policymakers should focus on the most vulnerable people, which may be more negatively affected than the population in general. Second, evidence is still not consistent. New factors and mechanisms have emerged, and other groups of population has been more affected in the recent and new economic crisis. Finally, mental health has been most sensitive to economic changes so far. Through my PhD, I focus on different economic shocks, such as retirement during uncertainty and worsened work atmosphere in my Chapter 1, or parental unemployment and household income inequalities in Chapter 2 and Chapter 3. Also, I focus on different subgroups of population, such as middle and senior ages in my Chapter 1, or young adults and children in my Chapter 2 and 3. In my first chapter, titled Retirement, Health and Great Recession, we aim to provide evidence on the relationship between retirement and health and the causal effect of retiring during an economic crisis on mental and physical health. We employ non-parametric matching models and difference approach on data from the English longitudinal study of aging. Our findings suggest that retirement leads to a deterioration in both mental and physical health. However, retiring during a Great Recession may improve mental and physical health outcomes for some group of populations. In Chapter 2, we aim to explore the relationship between health status in early adulthood and parental job losses during childhood. We employed a multi-level models on data from the UK household longitudinal study. We find that experiencing parental unemployment during childhood is associated with a lower physical and mental health status in adulthood. Chapter 3 explores the socioeconomic inequalities in children's health and healthcare access. We employed socioeconomic health inequities methods on data from the next step, which is linked with the health administrative dataset. We think that a better understanding of the factors that influence in health inequities in early life may improve health and well-being from the first stages of life. Policy lessons are that to be better equipped to address fiscal pressure in future, policymakers should aim to, first, mitigate the negative effects of an economic shocks on the health of most vulnerable. Second, support and invest in the children's and young adults' mental health. Third, address important gaps in children's health and healthcare access. Thank you.
Hello, my name is Denise Lovell and I'm a third-year PhD student based at the London School of Hygiene and Tropical Medicine. My PhD study aims to explore the intersection between food bank practices and household dietary practices using a mixed qualitative study approach consisting of a critical discourse analysis and an ethnographic study of 8 food banks in Portsmouth and London Borough of Brent. Embedded within local food and welfare systems, this study has found novel insights regarding the inherent power dynamics within the food banking system. The study has identified the food bank supply chain, as well as the nuances involved in tailoring food parcels to meet individual food needs and preferences, as well as the practical elements that households encounter when making use of the contents of the food parcels, which are rooted in structural poverty. The findings of this study will therefore help food banks consider the impact of their decisions when sourcing and providing food, and help identify ways in which food banks can be empowered to better manage what food is donated and subsequently distributed. For example, through the use of monetary donations and local authority funding. This in turn may improve the nutritional quality and appropriateness of the food parcels and help to move away from the existing notions of the giving volunteer and the accepting user, providing a more dignified approach to food poverty in the UK. Throughout this PhD, I've had the privilege of networking and engaging with various groups of people, including those relevant to my PhD and those who share similar interests, such as third sector organizations, grassroots activist groups, public health experts, and other PhD students. This has broadened my view on qualitative research and the power of listening and reflecting on people's stories and experiences on the systems, networks, and institutions that they function in. As a result of this PhD, I've developed as a researcher, becoming more confident and acquiring skills in critical analysis. I've developed a wider breadth of knowledge and expertise in sociology, food security, food systems, politics, and qualitative and anthropological research. Additionally, from this PhD, I will take away the importance and value of public and patient involvement and will aim to employ these techniques when considering future research projects to ensure that the needs of the populations and organizations that are being researched are met with practical and tangible outputs.
My name is Jenny and I did an SPHR-funded PhD at Imperial from 2018 to 2021. I'm going to talk a little bit about my experience. To quickly summarise my PhD, I evaluated nutrition welfare policies in the UK, such as the Healthy Start vouchers and free school meals. I did this using nationally representative dietary data. Some of my key findings were that certain groups, such as pregnant women, were less likely to use the Healthy Start vouchers than others. I also highlighted that the Universal Free School Meal Programme does have some important positive effects on children's diets. However, we need to think seriously about the quality of school food, such as considering the amount of ultra-processed food that is served in order to maximise the benefits of these programmes. A benefit of the PhD is it gave me the freedom and flexibility to respond to research needs at the time. When the COVID-19 pandemic hit, there were many negative consequences, and one of those was on the free school meal policies. In 2020, I produced timely research that showed that up to 50% of eligible children were not accessing a free school meal at the start of the pandemic. The report that we produced went on to be cited in key literature across the pandemic, such as the Marmot COVID-19 review. First and foremost, I feel this PhD has given me the skills and the confidence to pursue a career in academia. I feel I've gained the technical skills and the independence to make me feel confident applying for postdoc positions. I've also really benefited from the wider support of the SPHR community, giving me access to networks not only in research communities but also practice communities. I feel the strong focus on and relevance to public health policy will really benefit my future career, but I hope that it will also mean that my research benefits our society as a whole.
Hey, I'm Alice Porter. I've recently completed my PhD with the School for Public Health Research, which was titled What Exactly Are Me-Sized Meals for 1 to 5-year-olds? My PhD was mixed methods and it explored portion sizes in preschool children from 3 different angles. I explored portion size guidance and recommendations, parental portioning practices and awareness of guidance, and factors associated with the consumption of larger portions. I focused on portion size in preschool children because the consumption of large portion sizes has been linked to excessive weight gain in preschool years. In addition, the consumption of age-appropriate portion sizes can help promote a healthy intake of the key food groups and promote healthy weight gain. My first PhD study was a systematic review of online guidance resources. These resources were aimed at caregivers, such as parents in early care settings, and they included the portion size recommendations for serving preschool children. I identified 22 resources online and which could be used by caregivers to serve age-appropriate portion sizes. 6 of these are presented on the slide. However, I found although over half the resources were informed by expert opinion, very few resources were informed by the evidence base. And the recommended portion sizes were not necessarily consistent across all resources. There was variability in the recommended portion sizes of dairy, starchy, protein and high-fat, high-sugar food groups, as well as lunch and dinner meals. My second study was a qualitative study with first-time parents of 1 to 2-year-olds. I asked parents about how they decided the portion sizes they served to their child. I then showed them the portion size resources that I had identified in my review and asked them about their awareness of the resources and opinions on them. Most parents didn't recognise any of the resources, which suggests they hadn't been disseminated effectively. Most parents said they'd look for feeding advice during the weaning stage, but didn't tend to anymore now their child was 1 to 2, because they preferred to use their own experience and be led by how much their child ate on a day-to-day basis. Parents also mentioned using child dishware and the size of packaged food to decide the portion sizes to serve their child. My third study was a secondary data analysis of the National Diet and Nutrition Survey, which collected parent-reported dietary intake data from preschool children. I conducted multi-level modelling to explore the variability in portion size within and between preschool children, and explored potential factors associated with the consumption of larger portion sizes. I found the variability in portion size was explained much more by factors that vary from one meal to the next, such as eating environment, than factors that vary from one child to another child, such as child demographics. For example, I found eating in eateries, in childcare, sitting at a table with family members and friends, and whilst watching TV were factors associated with consumption of larger portion sizes in preschool children. So in terms of policy and practice, together the findings from my PhD can help improve practice to promote the consumption of age-appropriate portion sizes and healthy weight gain in preschool children. Together with the previous evidence base, my PhD research can also help to inform future childhood obesity prevention strategies and interventions. My PhD studentship has been an excellent opportunity to develop my career in public health, and I've developed so many valuable skills during this time, thanks to SPHR, my supervisors, and the University of Bristol. I'm now working as a research associate in public health and looking to do a fellowship in the future. Thank you for listening.
Hello, I'm Lizzie and I've just finished my SPHR funded PhD titled Adolescent Social Media User Types and Their Mental Health, Wellbeing and Social Connectedness. So my PhD addressed 3 main research questions. Number 1, how do young people use social media? So I developed a mixed methods typology of social media users at age 13, identifying 4 groups based on patterns of engagement with different online activities. Second, I tested whether user type had implications for subsequent mental health and found that they did. So quantitatively, I found that broadcasters, those characterised by very frequent messaging and passive browsing of content, as well as frequent sharing of content to large audiences, generally had the poorest outcomes at age 14. On the other hand, moderate communicators who used social media moderately and primarily for messaging or passive browsing, with little or no sharing of content, they generally had the best outcomes a year later. And qualitative analysis indicated several sources of digital stress that were specific to different types of social media activity. My third research question was whether social connectedness varied by user type, so connectedness to peers, family and school. And I found that it didn't. More important than user type was the quality of offline social resources, whereby social media was used to enhance existing close friendships or relationships with parents, but exacerbated feelings of mistrust and conflict where relationships were already poor. So I've had 2 papers published from my PhD, with a third currently in press at the Journal of Early Adolescence. And I first published these as preprints in order to increase visibility and support open science practices. And in addition, throughout the course of my PhD, I've collaborated with various colleagues working in similar areas, which have resulted in further publications. I've also presented my work at several conferences over the past 3 years. So those have included the UK Public Health Science Conference from Public Health England, BPS at Cyber Psychology, as well as the International Association for Suicide Prevention. And those were both oral presentations and poster presentations. In terms of other dissemination of my research findings, so I've worked with the Association for Child and Adolescent Mental Health to produce a video abstract and a podcast as well about my work. I've hosted webinars online for secondary school teachers and school pastoral leads, which have discussed my findings and thought collectively about implications that might be relevant for schools. And I've also discussed my work with third sector organisations such as Off the Record in Bristol and with local public health practitioners. But I'm probably most proud of the work I've done with young people themselves. So this is a screenshot from a short animation which was co-produced with members of the ARC West Young People's Advisory Group. So we discussed my research and they prioritised key findings that they felt would translate into positively framed recommendations for young adolescents, which were clear, relevant and accessible. And so the video has been widely shared and viewed by schools, parents, clinicians, and most importantly, young people themselves. Thanks very much for listening.